Welcome back, everybody, to webinar two of our series, Mental Health Matters, Navigating the Terrain of Quick K-12 Education. And so just a reminder from last week that our ultimate goal for students is overall academic success. But this also comes with considerations, as we know, and one of those considerations is mental health. And over the last 4 years, there's been a significant push on identifying and treating mental health issues in schools, which in many instances has actually been taking precedence, if you will, over academics, which is supposed to be what our main goal is in the K-12 setting. And while we can't ignore these mental health concerns, we also can't ignore the academic decline that we're seeing, increased behavioral issues, school attendance, as well as a decline in social emotional development. And so, what we're going to do this week, as we move into our webinar two, is we are going to talk about roles and responsibilities of mental health professionals in schools and what those actually look like. And so, some of our agenda items today is addressing the shortage and talking about what this looks like in regards to mental health professionals that are specifically placed in schools. So we're going to learn about legal and ethical concerns related to this shortage. We're going to talk about specific services that are actually appropriate for schools and which services should be moved back to the community. Looking at community-based mental health. We're going to hear from some school-based youth mental health providers, which we're really excited to hear specifically from those in the field. And we're going to talk about what their experiences have been as they work in our K-12 education system.
Thank you, Dr. Kuba. So I want to introduce a couple of careers that specifically work with youth mental health and specifically work within a school. Many of these careers and individuals, they do also work in the community, but if you notice, they may have a unique role because they have school in their title and/or so they're either hired by school districts or they are contracted by school districts. So we're going to learn about the specific and unique roles of our school psychologists, our school social workers, the behavior specialists, the community licensed professional counselors, and also the school counselors. So I want to talk about some of the shortages that we are seeing currently. So I'm just going to provide a couple of statistics that we have researched. And the first one is our school psychologists. So it is recommended by the National Association of School Psychologists that one school psychologist should be hired to serve every 500 students within the school. And so current national average is one school psychologist per about 1,127 students. So that is double of the national recommended average. And we're even seeing that there is a huge significant need. And some of these states even have higher ratios that we're seeing. So that's going to obviously limit their ability to be even deliver those services. School social workers. The U.S. Bureau of Labor and Statistics predicts that over the next decade, the way it's declining, there is going to be a need for 74,000 additional social workers that work in the schools. So they're already seeing a decline, and they predict that in the next decade, there's going to be a shortage of 74,000 of those individuals. School behavior specialist, this demand has really gone up for the increased need for specific supports for these students, not only the students themselves within the classrooms, but this individual also provides a unique support for the classroom teachers so that the teachers can actually teach, which is why they are contracted to be there. But as of 2024, listen to this, there's an estimated shortage of around $20,000. This is current. There is a shortage of 20,000 of these individuals as of 2024 nationwide. LPCs or your licensed clinical mental health counselors. Right now, there's a national shortage as of December 2023. So within the last 2 years, more than half. So this is 169 million of the US population lives in a mental health professional shortage area. So that means where they live, they do not have access. 169 million people don't have access to a licensed counselor. So they may have to travel upwards to over an hour in order to receive these services. And if you can also imagine specifically if there is an additional barrier of transportation, time, funding, then they're not going to access these individuals at all. We're really seeing a very high amount of shortages in those rural areas where there's already limited opportunities perhaps for some of these professionals. So a lot of times we're really seeing this disparity in our rural areas. And then moving to our school counselors nationwide as of 2024, so 48 states have adopted that there needs to be a school counselor to student ratio of 250 students to one school counselor. Now that's the recommended ratio, but the national average is actually 385 students to one school counselor. So we're seeing that one school counselor in the building has approximately 400 students that they are responsible for. But I'm going to be honest, that's probably on the shy side. There are a lot of school counselors reporting that their caseload is actually upwards to 700 to 800 students. And so this is huge. There are 17% of high schools in our nation right now. 17% of those do not have a school counselor at all in their building. These are individuals that are specifically and uniquely trained to assist these individuals, these students, to be prepared for post high school. And so that's going to directly impact our community. It's going to directly impact the jobs, the services that we can provide. These are adults that are entering our communities that have not had any access to post high school planning. Imagine that. So actually, we don't need to imagine that. That is a current statistic. We actually have that in our nation. So what is additional impacts that we have with these ratios and the shortage that is happening? Well, limited access to services. So we have individuals that are working in the schools, but because there's not enough of them, there's only limited amount of hours in the school day. We have students right now that have, even though they're supposed to have access, they have no access to these individuals and the types of academic services they provide, career development services they provide, and also that emotional and social services that they provide to these students. If they are lucky enough to get on a wait list to get these services, this increased time wait can be detrimental. And so I'll talk about that. Right now they may have a concern in these areas of mental health, but we know that mental health concerns, they just don't go away on their own if they are untreated. Research tells us that when these concerns are not addressed, they actually are going to turn into some critical, severe outcomes. And then having these higher caseloads for these providers, we're also seeing that many of these individuals are not returning. They're not signing their contracts. They're not coming back to the schools. We're seeing a huge decreased mental health provider retention rate. And then that's going to impact, again, this limited access. In turn, the negative impact, why are we in the schools to begin with? Our sole reason is to increase academic performance. We are there to help with those, the gaps that we see in academic performance. And we're seeing, instead of that increased, end of test scores, increased graduation rates, we are seeing a negative impact. We're seeing, graduation rates decrease. We are seeing student attendance decrease. We are seeing increase of behavioral issues, and of course, an increase of mental health concerns in the classroom. So untreated or unaddressed, uh, we're seeing severe outcomes. And these, of course, can be what we're seeing is these higher rates of maybe suicide ideation, suicide attempts in the classroom. We're seeing an increase of major disruptive behaviors to more than school-wide bullying and school-wide disciplinary to we're seeing students, an increase of school shootings. We're seeing an increase of violence within the school, bringing in, weapons and drugs and or other substances into our schools. So we're really seeing a huge impact on, the increase of mental health concerns, but also a decrease in the providers that are trained to help with these services.
Thank you for that, Dr. Bowles. And I know that Dr. Bowles covered a lot of the reasons for the shortages as she was describing the roles and the professionals that we're going to be hearing a little bit more from. So just kind of a review here on some of the reasons that we're seeing these shortages. One being lack of funding, but what I really want to point out here and something for all of us to think about. It's something that's actually being kind of looked into at the national level. Is it a lack of funding, or is it maybe misallocation of funds? Right. And so I think that's really a critical point. And one of the most important points I want to make in regards to the reasons for shortages and this slide is just that funding issue. And Noah Webster has a link that they're sharing with all of you as well that really helps break this down by state. And so that you can look at the Federal Department of Education and the breakdown of the funds and really kind of see what's going on. But I also think over the next few months, probably the next year, we're going to see coming down from the federal government where that funding has gone and maybe where it should be going. So think of I know we hear lack of funding a lot, but again, is it that or is it misallocation? We also talked a lot about the workload stats and how these professionals that are in a school have high caseloads, and thinking about what can we actually do when our caseload is even at the national level for example, school counselors 250 to 1, right? And so the workloads that we're experiencing is creating shortages, because then that leads into the retention of these professionals. Are they burned out, right? Do they have enough support to be able to provide the services that they've been trained to provide? And if they don't have sufficient support, then what does that even do to their own kind of mental health and self-care as they are thinking about pouring into others? We also know that salary can be an issue as well, and it's different across the nation. But again, we're seeing, single home families, we're seeing a raise in prices in some areas, hope to see that come down. But what does that mean for the professions like these when they need to be able to also support their families? Cost of continuing education. We know that people who work in schools, the professionals, the mental health professionals, but also the educators also have to do continuing education. Sometimes that's provided for free when you work in the school, but sometimes it isn't. And sometimes it isn't specific to that actual profession, right? Think about reading specialists. They have specific things that they need to be trained on, but that also goes for the mental health professionals. And so being tasked with adding that additional cost that potentially comes out of our own pocket can be impactful as well. And then something else I wanted to address too, reasons for shortages. Again, all of this kind of is encompassing, but then impacts mental health professionals or those that want to be mental health professionals, right? Looking for graduate programs. And we are definitely seeing a decline in students pursuing mental health degrees because of all of these things that we've already talked about. And so, as we've seen that decline over the last 6 years, it's concerning to think that it's going to continue. We already have a shortage, and what is that going to look like as we move forward here? So what we're going to do now is looking at these specially trained mental health professionals. These are the licensed credential professionals who are trained and equipped to specifically provide interventions for children in schools. We also want to make sure that we're stressing what is the role and responsibility of these professionals. But when it goes outside that scope, we want to be able to tap into the community. We need to know what's offered in the community, what those services are, and how to link our families to those services. So that community piece is a huge part of what we do in schools, because we are to maintain a specific scope of practice. And when it goes outside of that, we have to be careful to make sure that we are not working outside of that, and to then make sure that we are linking our students with the services that they need.
Thank you, Dr. Kuba. So the first one that we're going to really talk about and introduce you to are our licensed school psychologists. And when you're listening to the roles and the responsibilities of these individuals, I want you to also keep in mind that there is specific education for this specialty that these individuals have had to obtain. Many of them have a specialty level degree, whether it's master's, EDS, doctoral degrees, and they have already had to complete at least 600 hours or more of on-the-job training and their internships. These individuals are also members of their professional associations, which is very specific to their career. They have very specific code of ethics that not only are they aware of, but that they abide by on a daily basis. It's part of their role, part of them. And of course, they have very, very specific responsibilities. These are individuals that have gone through all of this education and all of this, training. They had to have earned a state license or credential to even implement these services. So some of the roles and responsibilities that these individuals have is they provide assessments for testing. It could be for, your IEPs, 504s. They also help with those IEP or 504 teams, helping to develop some of those types of interventions. They are also are equipped to be able to provide some counseling and support, intervention and prevention, again, social, emotional in nature. They consult with teachers. They consult with other mental health providers. They have the ability to consult with our community-based mental health providers, as Dr. Kuba said, a huge part of that. They are equipped and able to provide even crisis intervention with their specialty, crisis management, able to help those students emotionally regulate and provide definitely some services to those, not only with the students. A lot of our school psychologists also are trained and equipped to provide these educational and training opportunities to our faculty and staff. So again, I want you to keep hearing these credentialed individuals, licensed and credentials. So we have a school psychologist here, and we're going to hear from this individual what services are they qualified to implement.
Overall, the gist I got from my training was that we are huge collaborators. We are collaborating with all the stakeholders within the schools, administrators, students, parents, and other professionals. So a lot of my training focused a lot on what others do as well, which was a unique perspective I got. But we learned a lot on assessments and how to utilize assessment data to identify educational disabilities. We learned about counseling and the different strategies that we can use to give individual as well as group counseling. We learned about the different interventions we could potentially give, academic, behavioral, as well as how to track data to make sure those interventions are effective.
So as you can see, lots of different parts, especially that data piece, so important. And we also asked the school psychologist what were her current responsibilities at her school. So we'll also hear a little bit about that.
So that's a great question because we have been trained on so many things and it can vary district to district on what we focus on more than others. In my current district, I definitely work very closely with the special education team and help identifying educational disabilities. I administer a wide variety of cognitive assessments, achievement testing, social emotional evaluations. I conduct observations and interviews, all in all, trying to get a big picture of the student's needs and whether or not that is an educational disability that we can then give services for. That is a huge role within my district. I also do a lot of youth mental health first aid tasks within my district. So I'm a youth mental health first aid instructor. So I bring awareness to mental health challenges within youth. And I train everyone within our district on how to identify mental health challenges within youth, assess potential crises, as well as provide initial support, as well as teaching them how to connect them to the appropriate professionals. So that is a lot of what I do in my district.
All right. So now that we heard from a school psychologist, we're going to move into the roles and responsibilities of a school social worker. And so there's specific training and qualifications that individuals need to be a school social worker. But what I find interesting in doing some research about, social workers and what they do, is there's only one elective needed for them to work in a school system. And there's only one elective in their graduate program that addresses school-based social work. And so a lot of what they're doing, yes, they know what social workers in general do, but a lot of what they're doing is almost on the job training once they get hired as a school social worker, because we all know that the education system kind of has a mind of its own, right? Like it's its own entity. And so to only have one elective that's school based specifically is a little bit concerning in the regards of how do the qualifications of a social worker link most effectively to what is happening in a school. And so we do know though that social workers are specifically trained. They can have a bachelor's or a master's degree, but if they're wanting to do any type of clinical counseling specifically, they need to go on to get their master's degree. But some of the things that they are doing inside of a school that we're seeing kind of consistently across the nation is some assessment and evaluations, making sure that they're addressing the social emotional needs of students that are impacting, this is the key part here, their academic performance and well-being in the school. They're able to provide some counseling and support. Most specifically, what we're seeing is in small groups, which again is kind of a key aspect, which we'll be talking about in a future webinar of what that kind of looks like at the whole classroom level, small group, and then individual counseling. They're addressing crisis intervention situations. They're advocating for students and families based on the need. They're big collaborators, and we know that social workers collaborate inside the school, but also outside the school, and tend to be very knowledgeable about what services are provided in the community so that they can help support and encourage families to get the assistance that they need when it comes to those services outside of school. And so what we're going to do is we're going to just hear briefly from a social worker in the field and what her specific role looks like and what her duties are.
So all the things, I always struggle with like narrowing down what we do because it's a lot. But just overall, we like to think of ourselves as kind of the connection between school, home, and community. So kind of breaking down those barriers of families accessing community services, families getting connected to the schools for whatever reason. So we do home visits to engage the family. We have 2 social work cars that we can use to help transport families if transportation is a barrier to school meetings or to a crisis assessment or something. We also do a lot of connecting to community resources. So whether that's food, clothing, mental health support, crisis support, medical care, pretty much anything in the community we can help connect. We do sociocultural assessments, which is part of the special education eligibility process. And so that's an interview with the parent where we kind of go through family background, student background, basically the parent's perspective of what's going on with the student, strengths, weaknesses, behaviors, academics, all that good stuff. We do individual sessions with students, not ongoing, but more just as an as needed basis. We co-facilitate, typically co-facilitate groups with students, and that's usually done with the school counselor, just psychoeducational groups on social emotional skills, anger management, social skills. It really just depends on what's needed, but we can do a whole host of things with that. We do crisis support. So after something's happened in the school or in the community and we feel like a kind of a targeted approach is needed or targeted response is needed, we support with that. We also do threat assessments, which is when a student or someone has threatened to harm someone else or harm the building, and then self-harm risk assessments when the student has threatened to harm or kill themselves.
So lots of roles and responsibilities we're seeing. Again, it can differ across districts and across states, kind of depending on how that specific district has identified the needs of students and how they are kind of dispersing the services that are needed amongst the mental health professionals that are in the schools. And so we're going to hear from the social worker again, just briefly, as she introduces her scope of practice. Has there ever been a situation where someone has come to you and asked you, what is the diagnosis, or what do you think the diagnosis is, not realizing that really is outside of our scope when we're in the school?
Yeah, I think a lot of people try to diagnose, they see a kid who can't sit still. Oh, he definitely has ADHD. And they come to us like, well, this kid has ADHD. What do we do? And I said, does he have that diagnosis? Or are we just, making some assumptions? So we do a youth mental health first aid instructor along with a lot of the other social workers and some other staff. And that's a big part of what we do, is saying we are noticers. We notice behaviors, we notice changes, but we, including myself, do not diagnose. So just kind of educating on, just because you might be worried about something doesn't mean you have anxiety. Just because you can't sit still does not give you an ADHD diagnosis. So yes, redirecting them to the professionals who are able to diagnose and should be diagnosing.
Yes, love that she uses the word, first of all, connector, but also noticers. It really helps us to put a boundary around the scope of practice. So appreciate just that wording and explanation. The next one we're going to talk about is our behavior analyst or behavior specialist. And these individuals are typically contracted, even though they are working within the school. They're typically contracted, meaning they have a home base that really is a community agency typically. Obviously, as we're trying to make sure that we say that some districts, they do look differently, the way that some of these services are implemented. And I think a lot of that is what community resources are available in your schools, your school community, of course, and what's inside your district. Just like all the other youth mental health providers, there are unique and specific qualifications that these individuals must obtain before they even begin to implement these services in the school. Specifically, they must have their bachelor's or some have their master's degree, depending on what they can implement. There is a state certification for this type of training. And if you've heard of the Board Certified Behavior Analyst, or BCBA, certification, many of these individuals are either close to seeking or they have this certification in order to serve in this role. These individuals have their specific code of ethics that they must not only abide by, but that they implement each day. They have a variety, as we're going to hear from a behavior specialist in just a moment, but they do have a variety of roles. They do observations, classroom observations. They also are qualified for some assessments. They do intervention and support, crisis management. They consult with stakeholders. These individuals are often found directly, their services are directly implemented inside the classrooms as well. So we'll hear from a behavior specialist next?
I work with at-risk youth in a middle school. I provide services to children with trauma, ADHD, multiple diagnoses in the school setting.
So I want to bring your attention to one of the things that this behavior specialist had said. Specifically, her caseload is trauma, um, uh, various diagnoses. These are diagnosed children that they are already have a sort of diagnoses and also a plan that has been put together by other licensed professionals, and the behavior specialist, or the therapeutic day treatment behavior specialist, which is what this individual, her title is, they have to implement it. I also want to draw your attention to the percentage of students that the therapeutic day treatment behavior specialist serves. So in our webinar series, we do have a whole series on what we call the tiers. So we have various tiers of services within your school. So you'll often hear tier 1, tier 2, tier 3, tier 4. So I do encourage you to stay tuned for that webinar. But the therapeutic day treatment behavior specialists, they work with usually the tier 4 or tier 3 individuals, and the percentage of students that is 1%. So this individual's skill set is not meant for the masses. It's meant for 1%. This behavior specialist shared with us that she has a caseload of 7. In doing a little bit more research, she shared that there are approximately 680 students in her school building. So if you do the math, that's right on the money. That's 1% of the entire school that is on her caseload that she services. She has 7 clients. And notice she didn't call them her students. They are her clients. Very, very different than what a traditional teacher and educator, no teacher would call these individuals their clients. So very, very individual skill set. So we're going to hear a little bit more on a little bit more of what she shares. Basically, she's going to talk to us. How do you support the students in the classroom? So we'll hear about that.
There's a lot of behavioral problems in the classroom. So sometimes I will go in the class and sit with the clients. Sometimes I will take them out and process. We work on skills every day. They have coping skills that we work on for, it could be anxiety, it could be impulsivity, it could be self-harm. So we're working on different skills every day. I usually rotate to different classrooms, and then I have some clients that don't like me to come in the classroom. So they'll come to my office and we'll work on those.
So what's so interesting about this particular profession is that these day treatment specialists have the ability to float to different classrooms when they have their different clients. And this really, the next slides, or excuse me, the next video is going to share how that's a huge support to a classroom teacher. Classroom teachers have signed up to teach. Imagine trying to teach a class of 25, but you have to stop teaching so you can sit with a student for ADHD, for anything from ADHD to suicide ideation. That's just not possible. While we absolutely do have resources, especially something like ADHD, a lot of students have, those coping skills that can be implemented in a class. Having that other individual to help to verbally or physically help to redirect and keep that student on target while you're still teaching the rest, the 90% of the class, it's a huge service that this individual, can do for them. So we'll hear about that next.
Absolutely. And I try my best to support the teachers as much as I can. It may be that it's a 90-minute class period, and a child with ADHD is expected to sit for 90 minutes without, continually getting out of their seats. So I can support the teachers by providing like a movement break every single day at a certain time in order to decrease the behaviors that are happening in the classroom. I can assist them by sitting with the client, helping them to read. Some of these clients don't know how to read. And so even though the teacher, they're expected to read by middle school. So,
Right.
even with me helping them read every other line when they're struggling to read can be helpful to a
Yeah.
teacher.
Such a unique perspective and support in the classroom that they can provide.
All right. Thank you so much for all of that. There's some common themes I've heard, over the professionals that we've already covered, and this one is no different. So for school counselors, they have a specific code of ethics that they must follow, just like we've heard from all of the other mental health professionals. And so that kind of signifies just the importance of the role, and that they are held accountable for the services that they provide. And another piece of that we've also heard is just these specific and uniquely designed education and training that these mental health professionals must have. And so for school counselors, we're looking at the majority that's required to have a master's degree. And it's a master's degree in school counseling specifically. And through that, they must have supervised experiences at a practicum and internship level. Typically, around 700 hours they have to serve in a site before they can get their state certification or licensure. Different states call it different things, but they are ultimately licensed school counselors. And they're licensed through the state, just like a clinical counselor or an outside counselor. If we're talking about making a referral, they're licensed through the state as well. School counselors are just typically licensed through the Department of Education. And so what we're going to do here is we're going to hear from a school counselor, and she is going to talk about what her role is and what she does specifically at a school. But we know that school counselors have a plethora of responsibilities, just like we've heard from these other professionals as well. They're tasked, school counselors are tasked with individual counseling, small group, classroom lessons. They provide academic support, which I think is a big piece here that sometimes we forget, that school counselors do, again, integrate the academic support as well as the social emotional development and how it plays into the success of the whole child. So looking at the whole child. School counselors provide career guidance, crisis intervention, collaboration and consultation. That's a big piece also of what we do, which we heard that from the school social worker as well, is how are we working closely with not just the stakeholders inside of the school or the parents, but working with community members as well, so that we can make sure, again, that we're linking these families to the outside services that they need. School counselors develop a whole program. We call it a comprehensive school counseling program. And again, think comprehensive as the key term of all of the things that we do to make sure that student and family needs are met. And so let's go ahead and hear from our school counselor on what her role is in her school.
Our role, of course, in the mental health is to support the student and help them navigate through whatever personal social items that are going on, to be able to get them to the resources that are needed. That we have in our community, or even on a school-based level, because every school looks a little bit different, whether what they have in-house or outside. And more importantly, it is to continue to be that safe place within the school in order to, as they are navigating whatever mental health concerns they have. But again, it's always understanding our role. Our role is not to diagnose. Our role is not one that pretty much does any of the DSM-4, or it's evolved now, but it's more so in regards to making sure that families know the resources, families have the support that they need in order to help a student who may be in crisis or starting to present signs of crisis.
Yes, and I think one of the key things that she mentioned here is that it is not our role to diagnose. That is not what we do. That is outside of our scope. Within a school counselors are brief. We provide brief counseling services, meaning if you're talking about individual counseling, about 6 sessions. If it goes outside of that, that's outside of our scope, and we should be making a referral to a community a community agency that can provide more long-term therapy, right? And so even think about it as we're working with students based on what's impacting them in the short term that's also impacting their academics, and how can we help to alleviate some of that. And if we can't, because the issue is deeper than that, then we're making that referral out. So we're going to hear again from this school social work, or I'm sorry, this school counselor. And one of the key things I want you to just keep in your mind as she's speaking is awareness, that awareness piece.
Right. How do we tackle all the needs that we're starting to see? So schools were like, I still have the same budget. So how do I get creative with trying to help with those needs? And in the creativity, you started to see where they would have all employees, from bus drivers to teachers to every worker within the school division, start to go through youth mental health aid, workshops. You started to see where here are the signs, SOS. There were so many different programs, right? You started to see across the nation where districts were pushing it out because monetarily it helped fit the budget, but it also gave you a check mark. At least we're trying to train our people to look for certain signs or to help with the mental health crisis. Great thought, right? But there's always going to be some unintended consequences. And unintended consequences means that you put people who are non-credentialed in quite a difficult situation where they feel like they have to become a clinician, or they feel like they have to become someone who diagnosed, or they feel like they have to take on a role outside of, I'm a bus driver, an essential part of what we need, but now I'm supposed to help identify if this kid is depressed. Am I supposed to identify if this kid is suicidal? Or you have with a teacher where you're starting to see in the morning on your warm up, we're going to do restorative circles, or we're going to do mental health check-ins. That's not their role. And it becomes very overwhelming. And then you start to see turnover in areas that it was unintentional. You did not. They signed up to be one of the world's greatest educators in front of a classroom, in front of students, connecting them to whatever their subject is, not someone who's put in a mental health professional position. So that is where something started out really great, but because appropriate parameters weren't put around, I'm not asking you to diagnose. I'm not asking you to be on the forefront or the lines of being a mental health clinician. There was some unintended consequences that have placed, I believe, educators in a position where they feel like this is something else, that I wasn't properly trained, I'm not credentialed. Also, we're talking about liability and ethical dilemmas as well.
Yeah, and so I heard that awareness piece, right? And talking about other professionals in a school that sometimes feel like they're tasked with mental health things, but they're really not. It is about awareness. We even heard one of the other professionals talk about, I'm a noticer, right? So we've got awareness, a noticer, and that's something to make sure that we are educating those that work in a school. You stay where you're qualified, right? Stay in your lane is what we want to say. But we still need those individuals to have awareness and to be noticers so that they can bring those concerns to us, the mental health professionals inside of the school.
Thank you for pointing that out, Dr. Kuba. I agree, and I really appreciated that the school counselor highlighted the legal and ethical concerns. And I hope that when our school stakeholders hear the word legal, that has a heightened sense of, oh, it sounded like a good idea, but now we're dipping into some waters here where we could be liable and could actually cause harm when we were trying to overly task individuals that are not certified, as she shared. So I'm going to talk a little bit about the licensed clinical mental health counselor, or the LPC is what a lot of individuals know this person by, or LCMHC, depending on your state. But it is basically your community-based qualified counselor. Not to say that some of our districts do also contract in LPCs within a school. We do know that occurs. But we're going to specifically talk to a counselor who is in the community. And so, because we want to ensure that we are educating our stakeholders on these are our community resources that you must be aware of, that you need to be referring to, you need to be collaborating with. They are also resources available to our families, and they should be referred to these individuals. Why? Because they have the specific license, they have the qualification, they have the education, they have the training, they are aware of their ethical codes that they need to abide by. They have a heightened legal responsibility. When we talk again, we have a webinar coming up talking about, what does FERPA mean? But they understand HIPAA compliances. It's just a whole nother level of expertise that these individuals operate in every day. And so these individuals typically have their master's degree, many have their doctorate degree. They've had over 3,000 hours of supervised experience. Virginia in particular, it's 3,400 in addition to their 800 that they received in their master's. Again, this is post-master's training. So there's a lot of supervised hours that these individuals have been trained under as far as skill set, legal and ethical consideration. These individuals are specifically qualified for the long-term therapy. So again, the school-based individuals that we're all talking about, that we're probably familiar with the names, we want to make sure that we're not confusing with the word therapy. These are qualified individuals to work with DSM type of issues and concerns that really need this either specific individual, and many of them are with working with medical doctors also. These require a lot longer care. They also work with individuals that they develop these treatment plans. They can certainly collaborate and consult with our school-based individuals, but the primary care is meant to be referred out where they can have that relationship, that counseling relationship that transcends the school day, that transcends the school year. These individuals will work with these students on weekends, during breaks, in the evenings. They could be crisis related, where on a Sunday morning, if there's been a crisis, these are the individuals that are they are able to call upon. Where if you try to call the school on a Sunday morning, you're probably not going to reach an individual there to receive medical or mental health, type services. And LPCs, they can work in a variety of spaces, private practices, hospitals, community mental health agencies. They can do those referrals where they can do an intake and possibly refer to a hospital if the care is even very critical and or life-saving, where it does need to go to a hospital setting. So this individual that we're going to hear about, they again have that specific skill set, and it's meant to be those referred. And I want to draw our attention back to the tier 4, 1%. All 700 to 1,000 to 2,000 of your students that are sitting in your buildings, they don't need an LPC. The 1% perhaps is our tier 4, and they absolutely should be utilizing these types of services. They're not meant for the masses.
When I was in my graduate program, our focus, of course, in the mental health realm was on skills, counseling skills, case conceptualization, crisis intervention, ethical decision making, those basic counseling skills and advanced skills as well. So that was the bulk of my graduate level training.
So she's talking about basically her training, and the next one is going to be interesting. A lot of your LPCs are actually counseling your educators right now. So she's going to provide a unique look as far as, her scope and who her clients are.
I'm seeing so much of that. I as a clinician see teachers, I see coaches, I see a few principals, And I'm seeing teachers that are managing classroom behaviors that are linked to trauma and to anxiety. They have no idea what to do with that. I see faculty who are providing emotional support to students who are struggling with depression and suicidal ideation. I see staff members and coaches that are acting um, as counselors because there's nowhere to refer them, and the students are confiding in them, and it is really concerning in many ways because there's so much that they have a heart to do and they care, but they're not equipped, they're not trained, they're feeling very burned out, they're feeling very overwhelmed. And while these I think while these supportive relationships are really important, there's ethical concerns that arise when you've got these people that have a heart, but they don't have any training. They don't have that mental health guidance. They don't have the proper knowledge. And I have really been advocating in our community for some more collaborative approaches. Let's establish some clear referral systems and let's incentivize some of the clinicians to be able to take on these clients. So, what can we do to help support that? And how can we help make that more beneficial for the clinicians who are serving them, and also help them have the support they need in the academic realm so that when they get these students, they'll understand some of those other pieces and it will make it easier when they're working with them.
Something that she said kind of leads us into what our next discussion is, which she's really talking about other school professionals that might be asked or tasked with implementing mental health interventions when they're not credentialed necessarily to do so. And so as we move on to the next slide, here we're going to look at specifically teachers, and that's one of the things that that LPC mentioned was working with teachers, and they're like, I don't really know what to do. And so just like the mental health professionals that we spoke about, K-12 teachers also have specific training and qualifications. They have a code of ethics as well that they follow. There's roles and responsibilities that they're taught in their college program. Their main goal is K-12 academic curriculum. There is no mention in their code of ethics or in their roles and responsibilities that they're taught at the collegiate level. There's no mention of mental health. And I think that is something that we have to be very, very careful with, is putting tasks on individuals that are not specifically qualified. And so we know what teachers are supposed to do: curriculum, academic. They are the noticers because they do spend a lot of time with students. Do they need to be aware of what potential mental health might look like? Yes, but then they need to know, what do I do with that information? Who do I take that to? And we've just covered a whole list of mental health professionals in the school that we can take that information to. Okay. Other professionals that could potentially be feeling like they need to provide some of these mental health services are graduation coaches, career coaches, deans, right? Deans of behavior, administrators, principals, and assistant principals. The school nurse specifically could be one as well. Again, these are noticers, and they should be taking the information to the mental health professionals. You probably see on this slide too of teacher on special assignment. Sometimes teachers are assigned to a role, which is fulfilling their contract because they have an empty spot. So we know that there's a critical shortage of mental health professionals in schools. So there's teachers that are being placed on a special assignment or fulfilling the role of, for example, a school counselor, but they haven't been fully trained yet. And they might be in their graduate program, but they're not fully trained. And so this is certainly something that we need to take notice of. The same thing with school nurses. Again, going back to that, they have a code of ethics as well. They have CPR training. They have first aid training. Some of them, that's all they have to be a school nurse. They just call them a nurse because they're there to kind of triage and figure it out what does the child need. But there's nothing in their roles and responsibilities that talks about providing mental health services to students. And so that's important. And so when we go into this, noticer and awareness, that takes us into what Dr. Bowles is going to cover next briefly, which is youth mental health first aid.
Thank you, Dr. Kuba. Yes. So we've heard a couple of our youth mental health providers talk about youth mental health first aid. Typically, those individuals are, again, specifically and uniquely trained to be the trainer. And while a lot of our schools will train all of the staff, everyone from teachers to additional counselors to bus drivers to custodians to anyone that has access to these children, the whole purpose is to be the noticer. So there are absolutely strengths about this program. We both Dr. Kuba and I are actually, we also are very well aware and are trained in youth mental health first aid. We are trained to notice those signs and symptoms. But the training also goes beyond. It's how to connect to the professionals, either inside the building or outside. And it also allows us to know how to communicate, what to say, and what definitely not to say. But then the concerns are, even though the training is specific that they need to be referring, we sometimes do have school personnel who either have been maybe led to believe this or maybe take it upon themselves to say, hey, I've engaged in this one-day training, a couple hours long. I'm now fully equipped to go ahead and assess and go ahead and give these maybe youth harm or youth suicide types of assessments, when that is not the intent of this training at all. So those of you that are stakeholders that are watching this webinar, we hope that we are able to make sure that we are all talking the same language of, this is to bring awareness to these concerns with the 100% intent to refer to the individuals that are licensed, that are credentialed, and that have that unique skill set and certification to take that next step to help to connect to the proper treatment.
So that's a great question, because we know we receive a lot of training on that stuff. So with youth mental health first aid, it's just that initial contact. So it's being able to first just identify that this student is struggling, and that kind of seeing if it's something that we need to connect them to the appropriate professionals, like the counselors, the psychologists. And it's just overall bringing awareness to the different mental health challenges, as well as risk factors that are associated with mental health challenges, as well as potential warning signs. So it's all in all just keeping an eye on the children without diagnosing, without treating them, but just giving staff the courage and just education to be able to see these potential warning signs and then connect those students to the appropriate professionals. And I'm like, remember, we do not diagnose as youth mental health first aiders. We do not treat. And we overall expect the cultural considerations as well as the privacy of parents and students. So we make sure to kind of clarify that in the training, that that is outside of our role, as when we talk about diagnoses, potential medication management, and seeking further assistance, that it's within our role to just notice that a student might be struggling and then connecting them to the appropriate professional.
I appreciate her extra care that she takes when she does her training to make sure that individuals don't place themselves in a legal or ethical dilemma by overstepping their scope.
Yes, thank you so much. And so as we wrap up here, we really want to talk about, like, why is this information that we've just shared with you important, and what can we do? And ultimately, we know that our role in schools is to protect and educate. And that means protect students and educate students, but also protect our faculty and staff that are in the schools as well. And so what we want to make sure that we're doing is we want to make sure that there are very clear guidelines about what are the roles and responsibilities that the people inside of our school are uniquely trained to do. And we want to empower those professionals to do what they were uniquely trained to do, and not to do other things that could ultimately put students in harm's way. Right, because we know if we are not uniquely trained to do certain things, that can cause some challenges and cause some difficulties when we're working with our students. And so we want to make sure that we are hiring the appropriate personnel for these youth mental health issues. And we've identified for you who those are and what it is that they can do in a school to provide these services, these mental health services, but also what this looks like in regards to the academic realm, because there is a merging and a blending of those mental health roles and responsibilities with that academic piece. We want to ultimately make sure that our students are growing academically, but also socially and emotionally, and thinking about college and career readiness, because we want to make sure they're prepared for their future. Okay. And so making sure too that we are ready to consult and collaborate with others so that those in need are getting the services that they need to get to be successful. One of the key areas too, which I think has been missing at times over the last few years, is that collaboration with parents and guardians. They should be the ultimate decision makers about their child's mental health needs. They should be made very aware of what the academic curriculum looks like and sounds like, as well as any of the mental health curriculum that's delivered in classrooms and in small groups. And that's really, really important. And we want to stress that as well. And as you heard from the professionals that we've talked to today, is that collaboration piece is huge. They all said, we talk to parents, we collaborate with parents, we work with parents, we also collaborate with outside community resources. And again, that's another important piece as well, is making sure that everyone is very informed and knows what is happening inside a school. And then the other piece, which we talked about, was managing funding and looking deep into your budgets as school board members and administrators, and making sure that those funds are being used the way that they should be used. That those funds are being allocated in a way that supports students' academic growth, and whatever that looks like, to help them be successful. It could be mental health interventions, it could be behavioral interventions, whatever it is, just making sure that those funds are being used appropriately, so that everyone in a school can protect and educate our students. We want to thank you all for coming. I know there was a lot of information. I know that when you think about, wow, there's multiple mental health professionals in this school. And I think that's why, too, it's important for school boards and administrators to look at that, because there can be an overlap in those roles, but really identifying what are the specific areas that each of those individuals can provide, and making sure that we are providing them, but not double dipping, right? Because we want to use those funds the way that they should be used and the way that it's most effective. And so what we want you to do is we want you to come back next week for webinar 3, where we're going to talk about a positive school climate and adhering to those legal and ethical guidelines, which we talked a little bit about today, but we're going to go even deeper into that and how that impacts the school overall and the school climate, to ensure that our climate is positive and that it is conducive to learning for our students, so that protect and educate piece stays in place. So we are looking forward to seeing you next week, and thank you so very much for joining us.